morning and welcome to this i3 Health and Oncology Data Advisor interview. Today we have an exciting conversation planned ahead of our live webinar, Optimizing Neuroendocrine Tumor Outcomes, Closing the Gaps in Diagnosis and Care, which is being held on July 17th at 12 p.m. Eastern and also on August 5th at 3 p.m. Eastern. And I'm joined by the chair of the webinar, Dr. Aman Chauhan, who is the leader of the Neuroendocrine Tumor Program at the University of Miami Sylvester Comprehensive Cancer Center. Today, he's here to share a preview of some of the topics we'll be discussing during the webinar and why we should join. Dr. Chauhan, great to have you on today.
Thank you so much, Kara. I appreciate the invitation.
Absolutely. To start off, would you like to introduce yourself and share what you do in your roles at University of Miami?
So I'm a medical oncologist. I lead our Neuroendocrine Oncology program, and I also co-direct our Theranostics drug development program at the Sylvester Comprehensive Cancer Center. I treat all type of neuroendocrine cancers, from low-grade neuroendocrine tumors to high-grade poorly different neuroendocrine carcinomas. And it's a site-agnostic program. So as you know, neuroendocrine cancers can afflict any organ systems. So our clinic and program caters to head and neck, thoracic, GI, GU, gyn-onc, all site origins of neuroendocrine neoplasms.
Amazing. We're really looking forward to hearing your expertise during these webinars. So what are some of the most significant advances in the diagnosis and management of NETs that you'll be sharing?
Neuroendocrine oncology has seen some significant strides in last 10 years. And it's a very exciting time for so-called rare cancer, neuroendocrine cancer. We have seen significant improvement in both diagnosis at level of pathology, characterizations, how we classify different types of neuroendocrine tumors. For example, we now have a well-differentiated grade 3 neuroendocrine tumor. Previously, all grade 3s were poorly differentiated. We also have a better understanding of molecular underpinnings and molecular characterizations of these neuroendocrine cancers between NET and NECs. But more importantly, the tangible differences now are we have tools at our disposal like much better, accurate, and precise molecular imaging tests like dotatate, PET scans, etc. And all these techniques and improvement in diagnostics has really catapulted the field forward, and our therapeutics have tremendously improved. And some of the cutting edge tools now we have access to the latest targeted therapies, VEGF, TKIs like cabozantinib, or radiopharmaceuticals like PRRT, and several under the development and research pipeline.
It's really exciting to hear how many cutting edge advances there have been. So along these lines as well, what are some of the most common challenges or misconceptions that you see in NETs, and how will this webinar help to address them?
Yes. So one of the challenges in neuroendocrine oncology is a huge heterogeneity or variation in presentations, and also the natural history of disease progression. Neuroendocrine oncology or neuroendocrine cancer is very unique to that individual patient, and a lot of factors from grade to histology to morphology that will vary how the patient would present. Some patients are functional NET patients, then they secrete certain hormones which gives them certain classic syndromic presentation like carcinoid syndrome with flushing, diarrhea, insulinomas, etc. And others are non-functional and they have manifestations just born out of tumor burden or mass effect. So there is a reason why zebras is our mascot, because no two zebras have same zebra stripes. Similarly, I can have two pancreatic neuroendocrine tumor, but have very varied presentation, natural history of disease progression, and outcomes, because the outcome depends on the grade, the Ki-67, whether they're functional, non-functional, what type of disease burden they have. So that is the challenge. We have to individualize the care. It is unfortunately not very cookie cutter. Having said that, having multiple options helps us tailor those treatments towards those patients in a much more efficient way as compared to 20 years back, where we only had one or two drugs at our disposal.
Absolutely. Definitely looking forward to hearing your insights on these challenges and how these new advances are helping to address them. So I know another topic that you'll be covering is the role of multidisciplinary care for NETs. So how has this role evolved, and what are some of the practical tips you'll be sharing for effective team collaboration?
Yes, it is highly crucial to get a multidisciplinary perspective when managing an advanced or metastatic neuroendocrine cancer patients. This is one of those rare oncological processes where even in advanced disease, where metastatic disease, there is role of surgery, surgical debulking, targeted liver-directed therapy with help of our interventional radiology colleagues in liver-dominant disease. If we need to use latest and the greatest radiopharmaceuticals, we need help from our radiation oncologists and nuclear medicine colleagues to help develop PRRT. So in truest sense, this is a multidisciplinary field of oncology. And to be able to tailor the management, we oftentimes present our cases at a dedicated multidisciplinary NET tumor boards. It is just very important to get all the perspectives, because even as I mentioned, sometimes surgery is important in advanced disease to debulk the disease, to reduce their burden, to reduce their functional syndrome. So yes, I could not emphasize enough the importance of multidisciplinary involvement in management of NET patients.
Absolutely, such an important message to emphasize. So as I wrap up this interview today, what messages are you most looking forward to discussing during the webinar and sharing with the audience?
I'm very excited about sharing the advances that have happened in last decade or so in neuroendocrine oncology field in different facets, from diagnosis to treatment. I think some of the key things that we would focus on is teasing out these nuances between functional, non-functional net, low disease burden versus high disease burden, how to tease out how do we sequence therapies between second and third and fourth line. Now we have a problem of many treatment options. So how do we pick, and how do different prognostic factors like Ki-67 grade, tumor burden, functional status play into how do we pick which treatment would be better or not. Last but not the least, I think we are scratching the tip of the iceberg. The field is advancing forward, and there are a lot more therapeutic advances currently happening in research trials. So we're very excited to share a little bit of everything from NETS 101 to what's up and coming.
Amazing. We're looking forward to hearing about all these advances and insights. So thank you so much for coming on today to tell us about these topics. We're excited to delve into NETs further and hear some more of these insights. So for everybody listening, be sure to visit i3health.com or scan the QR code that will be at the end of this video to register for July 17th or August 5th. And Dr. Chauhan, thanks again, and we'll talk to you soon on the webinar.
Thank you, Kiara. See you then.